blood now and how it is helping us understand COVID-19 and how it's spreading across South Africa. The SA National Blood Service has released a seroprevalence study. It suggests many more of us may have had the virus than we believe. I'm joined now by Marion Vermeulen of SANBS. Good evening, Ms. Vermeulen. So the antibody study, it was sort of just under 5,000 people whose blood was tested. You were looking for antibodies to see, in other words, if they developed antibodies against the virus. And the results, just in brief, show us that actually we might have a lot more people who've had the virus than the official stats indicate. Tell us more.
Yes, absolutely. Thank you very much for having us on your show tonight, and good evening to all your listeners. The results of the study are really important for South Africa, I believe, because we have seen this really big difference between the results that we're finding in our blood donors from having antibodies, so seroprevalence rate, compared to what the actual rate that's being reported in the national statistics. So this one provides us a very current snapshot of the status right now in the provinces, but it also shows us, I think, that there are many more people that are infected than what we originally estimated, and I think this is valuable for our government so that they can make various related policy decisions with regards to COVID.
So I know that the study was done in 4 provinces, and I'm wondering, based on that, are you able to extrapolate and say, we guess on this survey that this percentage of South Africans have probably had COVID-19 already?
We can only do that really for those 4 provinces, so we can't extrapolate that through to the whole country. But we can take the samples that we have. They're not totally representative of the provinces because blood donors are a different population. They are a different population. So, for example's sake, we have a higher number of white donors than what would be in the general population, so they're overrepresented, and we have less black donors. They are underrepresented. But overall, in the study, we had about equal numbers of black and white donors.
All right, and
so
the 4 provinces, the 4 provinces, KZN, Eastern Cape, Free State, and Northern Cape.
Correct, and so we can then weight those results to the general population, and we can come up with some estimates for those provinces.
Okay, so tell us the results.
Well, so we saw it ranged really from about, I think it was 32% in the Northern Cape and Free State around there, and up to about 63% in the Eastern Cape. So Eastern Cape and KwaZulu-Natal having the higher rates, which was to be expected. They also had very high second waves as well, and with the inland Free State, Northern Cape having lower rates.
So you're saying that in places like the Eastern Cape, as many as 6 in 10 South Africans could have the antibodies already?
Correct, yes.
I see you didn't have Gauteng in the study. Why did you leave Gauteng out?
This was really for practical reasons. We have 3 laboratories in the country. This is a collaboration between ourselves and the Western Cape Blood Service. So there are 3 testing laboratories in the country, and the testing laboratory in Durban that services those 4 provinces has an instrument that has a reagent that's been regulated and approved by the regulators. The Western Cape and the Gauteng laboratory, we have a larger throughput instrument, and we're waiting for that reagent still to be approved so that we can then do the bigger areas, really.
All right, but it's very interesting that the Eastern Cape, as many as 6 in 10 South Africans could have had COVID-19, which means, obviously, they've got the antibodies. But we know the antibodies go away after a while. So how useful is this information?
Yeah, well, that I think nobody knows. So you're right. The antibodies, the test that we are using is really good and the antibody levels don't drop off quickly. So they last for at least about 6 months on this test, or they're detectable for at least 6 months on this test. So the people who we are detecting now in this study could have the old variant, or they could have the new variant. They could have been recently infected, and we can't tell that information at this point. So if they've got the antibodies to the old variant,
those antibodies may not confer sufficient immunity going forward. But also, even if those antibodies are to the new variant, if we have more mutations to the virus, then the same problem occurs. So we really don't know at this point whether there's any cross-reactivity between these antibodies that could give some kind of immunity to a certain extent. And if the virus doesn't mutate too much in the future, maybe at least the people who've got antibodies to the new variant may be protected for a bit longer.
So we've started we've started our vaccine rollout, but it's going to be fairly slow until it really kicks into high gear. Is this information about how many people have got the antibodies, is it useful in terms of rollout? How can government use it?
I think it is useful. I think we must also, though, not read too much into it. As I've just mentioned, you know, just because there is a high level of antibodies doesn't necessarily mean that we have a high population of people who are immune. So I think the vaccine rollouts are still very, very important. Maybe in conjunction with these high results, we can do further studies, you know, every 2 months or so, have a look to see what changes and whether we see an increase in the rates of the antibodies because of the vaccine as well as because of natural exposure. And that will at least give us, and the government as well, a good idea as to what the levels of antibodies are in the country.
Well, thank you very much. Very interesting indeed. That is Marion Vermeulen of the South African National Blood Service telling us about an antibody study that they have done on nearly 5,000 of their donors in 4 provinces in the Eastern Cape alone. It suggests that 6 out of 10 people living in the Eastern Cape could already have the antibodies.